deep in the heart of Texas. The difference between life and death can be measured in fractions of seconds, or in agonizing hours. When pain becomes overwhelming, it's up to the doctors to decipher the cause and effect.
I told the family that I thought he was going to die.
In the next 24 hours, the trauma team at Wilford Hall Medical Center in San Antonio will barely stop moving.
38-year-old female. She was found by her boyfriend in the hotel.
This unit is the only Level 1 trauma center in the Air Force.
Partial amputation of the right arm from an auto accident.
On average, 30 people die every day in Texas from serious injuries. 23-year-old Billy Balderas could be next.
Well, tell us the story. It was a van that ran on Main Street. He was drugged at least a half a block.
What do you know what happened tonight? Do you have any idea? Were you around him when it happened?
I was coming from my mother-in-law's house. I seen a van come out of the convenience store kind of fast. And all of a sudden, I just seen a body roll over like that.
And it just happened to be your cousin.
It just happened to be my cousin.
Talk to me. What's hurting you right now? The stomach.
Billy is a victim of a violent crime. He is in critical condition. Billy's cousin, Martin Pisana, saw the whole thing.
The guy got in his van and just took him with him. And just took him across the street and dragged him about maybe 100 feet. Take a big, deep breath. Big breath.
So you got thrown out of the van, or run over?
Got run over.
Okay.
Go! All right, his airway's intact. He's got bilateral breath sounds.
Keep your head still, okay?
Are you with me? And I need some betadine as well. Where are you at? Add to circulation. He's got good
108 over 68.
Bilateral.
Hold your arms still, please.
We got. What do we have for? We don't have anything for IV access, right? Can somebody get me 8.5 Fortis, please? Did he get his fentanyl yet?
I got it in my hand.
Okay, wait. Let's wait before we're all getting some pain medication. Here. Okay, we got you. We got you. X-ray. As soon as we're finished with this, tell me your name. Tell me your name. Tell me your name. Come on. What's hurting you right now? What's hurting you right now?
Suddenly, Billy becomes unresponsive.
Open your eyes. Open your eyes. Let him open his eyes. All right. You want to tell him the drug? Let's give him 20. Let's get 20 of Accommodate ready. Let's give him 100.
He's under 18 gauge in the right
100
wrist.
milligrams of succinylcholine. Let's get ready to intubate the patient. He's not responding to us any longer. Mandibles intact. Got it?
That thing was somewhat tender, obviously. It looks like tire marks across there. And he, just about 5 minutes after he got here, just went unconscious, essentially. And stopped breathing and was out. Is he talking to you?
Let's get up another 100 milligrams of succinylcholine in case we need it here, because it's been a while. So if we can get another 100.
Give a shot. I cannot get it through there. I can see him. I can't get it through.
Small blood, 92%. Small blood.
Right now, we've had to take over breathing for him. He wasn't breathing too well when he got here, and so we've gone and taken over his breathing. We put a tube down his throat to help him breathe. Surgeons are looking at him right now, trying to figure out what's wrong. I can't give you a whole lot of answers. We're trying to get him up to the CAT scanner right now. He's stabilized quite a bit, but he's still very, very sick.
Billy still isn't breathing on his own. The hope is that a CAT scan will help explain why.
These are all my medicines that I take on a daily basis.
27-year-old Michelle Thompson was born with a bad heart. Every day, she takes 7 different medications that help keep her alive.
Some of them I take twice a day, like 3 of them I take twice a day. I have a two-chambered heart. I have no pulmonary arteries, which is how you breathe. This is Coumadin, it's my blood thinner. It's basically for keep blood pretty thin, no clots form anywhere in the heart. I have Dextrocardia, which means that the heart is on the wrong side of the body. I don't think it's fully like on the right side, like you would just think it's on the right. I think it's the way maybe it's tilted or it's flip-flop backwards. This one right here is Lanoxin. It is for the heart muscle, to strengthen the heart muscle, keep it strong. Since I was born with this congenital heart disease, I have gone through numerous procedures and operations and many doctor visits. This one is a Lasix. It's a diuretic. I had my first heart surgery at maybe 3 or 4 days old. This is Protonix. This is for stomach ulcers. I had another one when I was 2.5. This is a Tenolol, and I think it's a blood pressure medicine. And this is Wellbutrin. It is a antidepressant. So, as well, this all affects my mental state, emotionally. So I think that it helps me deal with some of this sometimes.
By the time Michelle was 9, her oxygenated blood flow was so poor, she was literally turning blue.
In 1984, I had the Fontaine conduit, which was, they called at that time the corrective surgery for me at that time. They thought that was going to correct everything. I mean, we didn't find out till many years later that they had, the Fontaine was going to fail and they would have to make a modified version of the Fontaine. And, we're going to have to basically start at square one and do this all over again.
In 5 days, Michelle will undergo a complicated 4-part open heart procedure.
Oh. Thank God that's over with.
The first patient is Michelle Thompson. Ms. Thompson is a 27-year-old woman with a history of dextrocardia sinusitis.
For the past 18 years, the Fontaine, a passageway that carries oxygen-poor blood directly to her lungs, has kept her alive. But now it's failing, causing insufficient blood flow. She also has severe arrhythmia, an irregular heartbeat. Her doctor needs to repair her heart, or she will die.
They made me wear this the day that I came and consulted with the surgeon. He wanted to monitor my heart for about 24 hours. It's a tape in here so they can look over the tape and see if there's any arrhythmias or anything that they need to know before they do the surgery. And while he's in there, he said he would be happy to change my pacemaker out, because I do have a pacemaker that's located in my stomach. I always take Winnie the Poohs because I think I got my first poo when I was very young, and they come to the hospital with me. Y'all ready?
Yeah, I guess so. It's now or never, isn't it?
High above the city of Dallas, a highly specialized team of medical personnel takes to the skies to save lives. They're called Care Flight.
We provide aeromedical evacuation of injured and sick people.
Right there, what I got.
We treat everything from MIs to simple car wrecks,
The need for helicopters in the Dallas area is because of the territorial vastness around this metroplex. We not only service the metroplex, but we service 300-mile radius around the metroplex, which is Dallas and Fort Worth. People get injured out on the farms, or they get injured on accidents on the highways. They need rapid transportation to a medical facility, and that's the need for our business. We are one of the top 3 busiest programs in the nation. We're flying over 4,100 patients a year.
In the next few hours, a string of emergencies will keep the Care Flight medics on their feet and in the air.
We got a 14-year-old female who was riding a four-wheeler and apparently had a over handlebar. She hit something in the wood, next wood. Positive loss of conscious coordinator.
At Wilford Hall, Billy Balderas is intubated and still not breathing on his own. He is about to get a CAT scan to check the injuries caused by the van that ran him over.
He's not getting any contrast to his left kidney. His creatinine's up to 1.4. Probably for somebody his age, it should be down around 0.6. So he's lost some renal function, probably due to this left kidney not functioning.
Everybody ready? Yeah. 1, 2, 3.
Billy is heavily sedated and transferred to the ICU where doctors and family will wait and watch.
Does he have any more injuries?
Yes, he does. His left leg is broken as well. He has a pretty big fracture of his leg.
Overall, he's pretty lucky. Even if he loses just a kidney, I mean, he looks like he has tire marks across his belly. He could be a lot worse off than he is.
In fact, Billy Balderas is a lot worse off than he seems, as trauma doctors are about to discover. Craig Wilburn leads a cautious life, all because of the things he can't do.
When this happens, you'll sleep upside down if you have to. You'll do anything to try to stop the pain.
He struggles to get in and out of his car. And to just sit down at work.
The wearing during the day, that slowly it builds up on you and wears you down between getting in and out of the car off and on and then sitting down in here. So it's a constant part of you. Have a good weekend. See you later. Bye.
For this 50-year-old insurance salesman, severe pain in his lower back has made doing even simple things almost impossible for the past 6 months. Like 22 million other Americans, Craig's life has become consumed by his pain.
I'm going to Walgreens I need to get a new heating pad, something I try to use periodically.
Hi, how can I help you?
Need a heating pad?
Oh, we have plenty of them. Let me show you.
You know, you want to go do the things that you've done all your life, and you don't want to look at the rest of your life that that's going to be limiting you, you know.
It's a moist heat, dry heat with an auto off.
Yeah, everybody has a passion or something that they enjoy doing. To not be able to do that has been it just changes your lifestyle to a certain extent, and then you have to readjust, and I hadn't completely done that yet. Let's do the moist heat.
There you go, sir.
Thank you much. Appreciate it.
Yes, sir. Enjoy the rest of your day.
You bet.
But Craig wants permanent relief. And for that, he's about to try a cutting-edge procedure now being studied in the small town of Tyler, Texas. 8:30 a.m. on April 12th. Care Flight transports 36-year-old Anthony Jones to Baylor University Hospital in Dallas, the only Level 1 trauma center in the area.
Patient awoke this morning, 05:45, severe headache, EMS was called. He's got no history, no allergies.
Anthony Jones has all the signs of a possible aneurysm.
It's real lethargic, complains of the headache to the posterior aspect of the head. Feels like it jams down into his shoulder.
Speak to me. Tell me your name. Open your eyes for me.
Basically, the gentleman had a severe headache this morning, sudden onset, and went to an outside hospital where they got a CAT scan on him. Because of this, it would be a sign for subarachnoid hemorrhage or some other intracranial injury. And they got this CAT scan, which looks like there's blood in these areas that are consistent with a subarachnoid hemorrhage.
Anthony, has your headache changed at all since we left the other hospital?
Is very sleepy, and that also happens with the subarachnoid hemorrhage. So I get a neuroradiologist to read it. I'll talk to the neurosurgeon. We'll get him admitted to the hospital, and then they'll go from there.
Wake up.
How you doing, sir?
It's imperative that Dr. Datian identify the cause of Anthony's pain. It could be any number of things.
I understand you woke up today with a bad headache, is that right?
Anthony, answer the doctor's questions. Try to stay with us, okay?
Did he get anything en route?
He got some stuff at 7.
Do you have any health problems? High blood pressure, diabetes, none of that stuff? Any history in your family of aneurysms or bleeding problems?
Anthony is awake and can move all of his extremities, a good sign, but doctors are cautious.
Occasionally you get somebody who comes in with an episode of severe headache and then they pass out. And then they're fine here, but you get the CAT scan and it turns out to be a subarachnoid hemorrhage. So you gotta be careful with those. Do you smoke cigarettes? Drink alcohol? Okay, good, good.
Come over here, and you can talk to him and wake him up. That's good for us, okay? Let us know. Your wife's here.
An undetected aneurysm can result in a severe stroke or death, and it can strike at any time. Doctors request an immediate arteriogram, an X-ray of his blood vessels.
Good morning. Good morning. How are you guys all doing, okay?
Not really. Really nervous.
At Texas Children's Hospital in Houston, it is the morning of Michelle Thompson's surgery, a daring operation to repair the heart that has been defective since birth.
So we'll go from here. It looks like they're ready for you. Okay. Take poo.
This, these are just chest x-ray images.
These two x-rays show a healthy heart on the left and Michelle's on the right.
Immediately obvious. First of all, her heart's very enlarged. It's really, really big. And the tip of the heart, the tip of a normal heart points to the left. That's the way hearts are meant to be put together. The tip of Michelle's heart points to the right. We call it Dextrocardia. So her heart's backwards, if you will. It's inverted.
9:30 a.m. Michelle is ready, but anxious.
It's okay to scare me.
Okay, Michelle, we're going to start giving you some medicine to make you a little relaxed and sleepy here. You should be ready here in just a second.
You're gonna get goofy like your mom.
And then we're ready to go. So we're all set. So if you want to give her a kiss, now's the time.
Taking her away already?
All set to go.
6 hours after being run over by a van, Billy Balderas takes another turn for the worse.
The first few hours after his trauma went by, his blood wasn't clotting normally, and he developed an expansion of the hematoma in his left temporal lobe, and he was deteriorating rapidly, and we decided to take him to surgery.
Billy has developed a blood clot in his brain that requires emergency surgery.
The idea behind decompressive craniectomy is that before they get in irreversible trouble, You take them to the OR and you take out the damaged area and open the bone up and expand things so that the swelling can happen out away from the brainstem, giving the patient the best chance possible to recover from the injury that they sustained.
Neurosurgeon Dr. Lee Warren is planning to remove the blood clot. If he doesn't, Billy won't survive.
Brain has been shifted over. This should be all balanced from one side to the other, and it's pushed from the left to the right by the pressure that's developing in this left side.
During the surgery, Dr. Warren removes the clot, but he also has to remove about 5 centimeters of dead brain tissue from the left temporal lobe, the area that controls speech and language recognition. The prognosis is discouraging. If Billy survives, he may never be able to speak or understand language. In all likelihood, he will end up brain dead. It's 11:35 a.m. at Texas Children's Hospital, and 27-year-old Michelle Thompson is about to undergo a life-saving open heart surgery.
You're gonna be okay.
When her heart formed, instead of having 2 pumps, she had 1.
Dr. Frazier has successfully performed this type of surgery more than 20 times in his career.
Normally there are 2 ventricles. The left ventricle is very thick-walled, meant to do high-pressure work, pumping blood out the aorta to the body. The right ventricle meant to do low-pressure work, pumping blood to the lungs.
With only 1 ventricle, Michelle's heart was unable to pump blood directly to her lungs, and the Fontan procedure, performed in 1984, is no longer working, causing the pressure in her veins to rise dangerously high.
This right atrium has just become enormously dilated. Dilated, hypertensive, high pressure, and then so the blood starts to backs up into the head, into the arms, and down into the body, into the liver, the kidneys, the intestines.
Today, Dr. Frazier and his cardiac team will trim down her oversized right atrium, stabilize her rhythm, revise the Fontan, and replace her 6-year-old pacemaker in a lengthy and complex operation.
Well, right now we're just cauterizing the fat and exposing the previously placed sternal wires.
The sternal wires, which have kept Michelle's sternum together after previous surgeries, have grown densely into the bone over the years.
But we have to have them exposed and removed as much as possible because the saw can't cut through them. You can see the heart pulsating there right underneath the breastbone, and we're just going to have to go very slowly here because I'm concerned about getting into the heart there.
Cutting through Michelle's dense scar tissue prolongs the task of getting to her heart, but there are other problems.
She's got some great big dilated veins up here underneath the top of the sternum, and see they're really starting to bleed there. There's quite a lot of blood coming back from these big dilated abnormal veins, and this is going to be a bit of a problem.
Michelle could bleed to death in a matter of minutes. Dr. Frazier sutures the dilated veins to stem the flow.
Okay, well, we've gotten into some serious bleeding here. Anesthesia needs to get some blood for transfusion. She's going to need some blood now.
After being transfused with 4 pints of blood, Michelle's condition stabilizes. Now, Dr. Frazier can dissect out the heart and study the anatomy.
We're going to have to get access now to Michelle's aorta, which is the large blood vessel that carries the blood to the body, and we've got to get up to it to get enough view so we can put a tube in it or a cannula to connect it to the heart-lung bypass machine. Her aorta is very abnormally positioned. It's way to the left of her body. It's actually not underneath the sternum as it normally would be. It's way out in the left chest, and it's just very hard to get access to it.
Once Dr. Fraser accesses the aorta, he can hook Michelle up to the heart-lung bypass machine. It's taken 5 hours to get to this point in the operation.
Michelle's doing well. We went on the heart-lung bypass machine at about 4:18. That went very smoothly, okay? Dr. Fraser has studied the external structures of the heart. He's studying the internal structures of the heart, and we're trying to make a plan for the rest of today. But throughout all of this, she has stayed very stable, okay?
Craig Wilburn has driven 115 miles to the East Texas Medical Center in the hopes of finding relief for his debilitating back pain.
What we're going to do today is we're going to do a test that you know a little bit about already. It's called a discogram.
But first, he has to qualify for the study.
The MRI shows that you have a few discs that have some bulges and some tears, but that doesn't tell us that the disc is the source of your symptoms. The best way we have to learn is to do a disc test called the discogram. Craig, you're going to feel a little pinch.
Dr. Kevin Pauza is looking for patients with disc problems.
The discogram is different than an X-ray or an MRI, or it's different than a myelogram, because all of those tests are just pictures where they see what things look like. But the discogram is actually a test where I see what things look like and I see what you feel, because that's the whole goal, is you're here to have pain treated. So the discogram is a provocative test. It's made to provoke your symptoms.
Craig's symptoms are provoked by attaching a device to the needles to increase air pressure on the discs. The test is painful.
1, 2, 3. You're doing wonderful, though. Everything's going perfect. I think we're done with the hard part. Let's take 2 pictures now. We're going to rotate the X-ray machine. Right now, I'm just putting a trace amount of contrast in, just checking the pressure that's inside your disc. That change may be a pressure, or instead it may be a pain. But you tell me the very second it begins to change, okay? Here we go. 1, 2, 3. From a 1 to 10, how intense was that pain that you felt? 3 or 4. Here we go again. Okay. You tell us if this changes, okay? Yeah, that changed. That was at 26 psi, 0.5 cc's. Yeah. From a 1 to 10, how intense was that? That was climbing towards 10. Was that in a location like your typical symptoms? Yeah. Okay. We're done with the test. You did wonderful.
Craig is moved into recovery. Dr. Pauza will come back later to tell him whether or not he qualifies for the procedure that might end his debilitating pain. Earlier today, Anthony Jones was airlifted to Baylor University Hospital in the nick of time. His symptoms indicated a possible brain aneurysm.
Terrible headache, worst headache of his life. Explosive, severe headache. The old stories usually is, well, a bomb went off in my head.
A CAT scan only confirmed the suspicions.
Well, there's high density in the suprasellar cistern. It's this star-shaped increased density that should be black. This is abnormal as well.
Let's flush the needle here a little bit. See if we can get in the artery. A tiny little nick there in the skin. There we go. This is the catheter, which we're going to put up into the blood vessels in his neck that lead to his brain.
Neuroradiologist Dr. Joe Heiss threads a catheter through Anthony's groin so he can take an X-ray.
So we're going to inject 6 cc's of contrast per second for a total of 8 cc's of contrast. Okay. Anthony, I'm going to take my first set of pictures here. You may notice a little bit of a bright light in your left eye, okay? Do you hear me, buddy? But it won't hurt. Your job is just to hold real still for me.
The dye causes the blood vessels to appear opaque on the X-ray image, making it easier to identify a possible aneurysm.
Clear across the anterior communicating complex where common home of aneurysms would be right there. We've cleared that. No ACOM aneurysm. So we need to get another view. We need to get a lateral view. Is everything clear? Okay, very still. Nothing on the back wall. Come on back just a little bit, sir. I'm just going to come back a little bit. Back to the arterial phase. Okay. Nothing at the ophthalmic either. Okay. Okay, buddy, we're heading for the arteries in the back.
The arteries in the back of the head could be just the place for an aneurysm to grow. Right now, Anthony's chances are only 50-50. At East Texas Medical Center, Craig Wilburn is hoping to take part in a unique medical study to try to relieve his chronic back pain.
Yeah, I bet. Everything went well. We learned that your pain comes from 2 discs.
Right.
One thing I want to tell you, though, there's a chance that the discs may get better.
So am I in the study?
Yes, you're a candidate for the study.
Okay.
He's a perfect candidate. He has disc pain, pain that was proven by discography. It's in his back, it's not leg pain, it's not sciatica, and that's exactly what we treat.
The procedure is called an IDET, intradiscal electrothermal therapy. It uses heat to eliminate pain in the discs rather than removing them.
The IDET does 2 things. It heats the protein so that it shrinks. It also heats the nerves so that they cease function. They stop transmitting pain to the brain.
But there's one crucial catch.
Craig has a 60% chance of receiving the IDET procedure and a 40% chance of receiving a sham procedure or a placebo procedure.
The double-blind study is the only way for Dr. Pazza to determine whether back pain sufferers can improve without receiving the real IDET procedure.
The procedure is determined to be FDA approved, it's safe, but now we have to learn the true efficacy of the treatment. Does the treatment help a person, or does the treatment not help a person? I'll direct needles down to those 2 discs, and then I will or will not direct the catheter around the discs to heat them, depending on whether or not the computer tells me he should be in the study or not be in the study. Getting close to where I want to be. Okay, good. Now what I'd like to do is have you open up the envelope to tell me what we're doing. Now it's a matter of waiting 17 minutes.
If Craig Wilburn is receiving the real IDET procedure, the next 17 minutes could spell the beginning of the end of his chronic back pain. 24 hours ago, doctors had almost given up on Billy Balderas.
I was very down on his chances to do well. I told the family pretty frankly that I thought he was going to die.
But hours after an operation to release pressure from his brain, Billy Balderas is making a stunning recovery.
He sort of surprised us. He stabilized, his blood began to clot normally, and over the last 12 hours or so, he's actually opened his eyes a little bit, and he's moved around a little bit. So he's currently alive, but he's really neurologically injured, and he's not out of the woods by any means.
Billy is stable enough to undergo an orthopedic operation to reset his damaged thigh bone.
Let's go ahead and get started.
He has a long bone fracture in his leg, that if he does survive and recover from this, he'll need to have good use of his legs. And so they're going to repair his femur, and we're all going to give him the best chance that he has to have a normal recovery. So we're continuing to be very aggressive with this care.
Billy actually has 2 fractures, one in the femur and another in the ball of his hip.
There is some urgency here, okay? This guy's got a brain injury and we want to get him off the table, okay? Give me the drill, please. X-ray. X-ray.
Part of the procedure is aided by fluoroscopy, a sort of real-time X-ray. A radiolucent table helps doctors align rods, pins, and screws every step of the way.
Picture. Picture. X-ray. Oh, looks like I'm having a little medial. Change your direction a little because you got the pin captured now. Right. Without changing in the lateral plane. No, we'll run out of room. All right, you shouldn't be hitting, it shouldn't be hard, so come on back. I think you're ready to pass your guide wire, Docky.
Surgeons will insert a guide wire through the bone to create a pathway for a rod that will go into his femur.
I think it's in. X-ray.
4 screws will lock the rod in place.
Up that way.
They have to be carefully placed, and the limb must be properly rotated, or the foot could end up pointing in the wrong direction.
How's it going? Shot. Shot. Let me see the depth gauge, please. You better get your tonsil in there and grab it. That's your last chance, doctor. I think it's okay. All right, doctor. Irrigation. All right, Rick, not bad, huh? You knew you had it.
This is Billy's 2nd major surgery since his accident. When he wakes up, doctors will see just how much brain damage he has sustained. "7 hours into a life-saving cardiac procedure, Michelle Thompson is little more than halfway through. Her family is starting to feel the strain.
At times I think I'm ready to give her up, but then I'm not. We've been lucky to have her as long as we have. It's not time. I haven't had enough time with her yet. So she's gonna be okay. She's gonna be fine.
With Michelle now on the heart-lung bypass machine, Dr. Fraser trims Michelle's oversized right atrium, which is obstructing her blood flow and contributing significantly to her irregular heartbeat.
We think that removing all this extra atrial tissue and debulking the scarred up portion of the atrium may have a role in reducing the tendency for the patient to get bad rhythms again in the future.
But to permanently correct Michelle's arrhythmia, Dr. Fraser makes a second repair using a high-frequency radio probe.
And we're going to make some burns, essentially, in the atria to limit the propensity for future dysrhythmias or bad rhythm occurrences.
No, now you're doing it well.
That's the way.
9 hours into the surgery, Dr. Fraser finally begins the fontan. revising the pathway that will allow Michelle's blood to flow from her body directly into her lungs.
So we can now construct this efficient venous pathway, so which is what we think is the real benefit of this operation, is to getting the blood to the lungs in a more efficient pathway, so that the pressure in her veins throughout her body can be lower. Okay, so we finished all our connections, we've got our catheters in, we're ventilating. I think it's time to come off the heart-lung bypass machines.
Sensing's about 0.7 millivolts, 0.5, 0.5.
In the final phase of Michelle's operation, Dr. Fraser replaces her 6-year-old pacemaker.
And there the generator is going into the pocket, which is underneath the abdominal wall.
At 11 p.m., almost 12 hours after the first incision, Michelle Thompson's surgery is finally over.
Where are they?
Right here.
Hi, is this Dad?
I'm Mitch Thompson.
How you doing? Nice to see you. Well, we're all done.
What can go wrong?
I can't list everything that can go wrong, and I mean that's why we have ICUs. But I think, I'm happy with the way surgery went. It was difficult and long, but I'm happy with the way it went. Again, we knew, as we had discussed, that the options for her were going to be difficult. We were expecting that.
For the next 8 days, Michelle's family will make their home in the cardiac ICU as they wait and see how she will recover.
Last picture, buddy, nice and still.
At Baylor University Hospital, Dr. Joe Heiss is almost done exploring Anthony Jones's brain.
I think we're finished here. I'm just checking your pictures a little bit.
He's looking for a possible aneurysm.
Here's the right carotid. Again, a lateral projection. Nothing there, nothing there. Okay. So it's a done deal. Okay, guys, all done. I did not find an aneurysm, okay? There are about 10 or 15% of people do not have aneurysms. He does not have one. At least he does not have one we can see right now. And about 98% of the time, if you can't see it at the beginning, it's not there. Okay, guys? Question? No? That's mostly good news, okay? Okay. Okay.
For Anthony, a near crisis comes to a happy ending. Thanks in no small part to the care flight team that responded to his emergency.
This is your 6 weeks follow-up.
Right.
And we've not met before. You were screened.
Craig Wilburn has returned to the East Texas Medical Center to meet with Dr. Paul Dreyfus, who has taken over his care. He still doesn't know whether he was given the actual treatment or the placebo.
This is pretty early on in the game, so it doesn't mean you got the real treatment or you didn't. We've seen all kinds of responses.
No problems with those?
So you're here today just to make sure everything is as we expect. There's no medical problems.
Okay.
If you have any questions, we're available to you.
Appreciate it.
We'll go here and finish it with the therapist.
Okay. Thank you very much. Appreciate it.
As I mentioned, there are 5 exercises.
Okay. I really don't have an idea, yay or nay, and I've speculated on it back and forth, and finally I realized it's a waste of time, so we'll just keep plodding along.
The exercises I'm going to show you, you'll do twice a day.
I hope there's a positive outcome.
Put your hands in.
I think a car hit me or something. That's all I remember.
The fact that Billy Balderas can remember anything at all, or that he's even talking, is a medical miracle.
They said I was probably gonna die, so there was a lot of people praying for me, so and then I just went back. And I'm undiagnosed, so.
A month ago, he was run over by a van.
What do you need? Stairs of abrasion across. Okay, we got you. 1, 2, 3.
The next morning, he underwent emergency brain surgery for removal of a hematoma from the left temporal lobe.
I am totally amazed. For him to be alive, first of all, is phenomenal. And then for him to be able to speak and understand language and everything with a dominant temporal lobe injury like he had, it's really miraculous.
Today, he's about to go under again.
I'm just going to open Mr. Balderas' scalp back up and put his bone back together, clean up any brain or anything that may have died that's still sticking out of his head, and close everything up, and then put the bone back together and close his scalp back up. He's been wearing a helmet because he doesn't have, his skull is gone over here. It's just brain exposed. So he's been wearing a helmet in case he falls down or anything. He won't need to do that anymore. He'll be just back on his feet.
Once the area is cleared of any brain matter, Dr. Warren is ready to replace the piece of skull removed in the first operation.
It's been freeze-dried for a month. There's still some of his original temporalis on it.
Titanium plates will help secure the piece back in its place.
He's got good blood supply to his scalp, so he'll heal up real nice. Okay, sounds good. Now once it's set like that, all you have to do is push him down. All right, can you finish him up? Make him pretty?
The surgery takes less than 30 minutes. Tomorrow, Billy starts a lengthy rehabilitation.
You look good. Told you we're going to be praying for you.
I want to get him back to rehab and back to his life. Hopefully not stepping out in front of any more trucks.
The doctors did an awesome job on you, and you're doing great. Say thank you, Jesus. Amen.
It's been almost 3 weeks since her open heart surgery, and Michelle Thompson is finally ready to go home.
20 days today, it's a long time. Just the word discharge just kind of heals, you know, makes you feel better in itself.
Oh, I'm so happy to be going home with my daughter. She looks great. She really does.
Yes, I will, I promise.
Does this look real? Time to get out of here.
Yeah, I just want you to sign that pillow before.
The real measure of success is going to be how this serves her long term. Does she stay in a stable rhythm? Does she feel better? Is her quality of life better? And so time is going to be our measure on that, and that's how we'll judge success.
There are moments that I have of uncertainty. If I will have a long life, if this is going to prolong my life, or, yeah, I'm scared, but I think I've kind of lived with stuff like this, so I know that it's something I have to do.
Oh, sweetie, you've done great.
I wish I could say we're going to Disneyland, but I'll just say there's no place like home, and we're going home.